Okay. This one was originally addressed to Senator Cardin, but I think anyone can take it. Do you support revising or repealing the creation of the Independent Payment Advisory Board created by the Health Reform Bill?
I could defer to the Medicare, the government payment issues are matters that are going to have to be continuously reviewed. I'm happy that in Maryland our hospital reimbursement structure is not under the CMS structure. I'm all for trying to get more flexibility in the way that we deal with provider fees and arrangements. The problem is that we need to keep government costs down, and one of the ways we do it, we hope, is through this commission. Am I willing to review it? Absolutely, but we're going to have to stick to certain budget expectations as we go through this process.
And for those of you who didn't follow this piece of the healthcare reform bill that closely, this was an independent commission that was created to try and get a handle primarily on rising Medicare costs. We talked earlier about the importance of trying to get our deficit and debt under control. As part of that, I think we all recognize that we're going to have to find ways to bend the cost curve when it comes to our medical expenses in this country, both in the publicly funded programs, including Medicare and Medicaid, but also on the private side, because medical inflation has obviously been going up at a much greater rate than regular inflation, and that's put incredible pressure on the federal budget as well as on your budgets paying for health care. So this independent board was established to try to review the increase in healthcare costs, and to the extent that the healthcare reform bill mechanisms do not get the cost bending effects that are hoped for with the number of different innovations that were included in that, then this panel would be empowered to recommend certain changes to the Congress, and unless Congress overrode those changes, they would take effect. As Senator Cardin said, it's not a perfect solution by any means, and I think all of us are probably open to looking at alternatives. I would say, however, that all of you know that the problem it was designed to address is a very real one, and if that's not a part of the solution, we're going to have to figure out something else together.
There are two huge cost drivers in healthcare, which is increasing at 2 and 3 times the rate of inflation. Clearly, we have got to do something about that, or it will eventually bury us. This healthcare bill did nothing about one of those. That was the tort report. Defensive medicine may account for 25% of all healthcare costs. It's not just $125,000 premium. Studies have shown that there may be 6 to 8 times the defensive medicine practice as compared to the cost of. So that's up to $1 million of additional healthcare costs just to protect yourself as a doctor. That bill did nothing about tort reform. A very simple solution to that, by the way, simply give the doctor and the patient a separate path to travel, where they agree up front the patient's not going to see the doctor. If a mistake is made, and mistakes are made, which is the way we have erasures on fences, he or she would be awarded by an awards board just like workers' comp. We're not plowing new ground with this. The second huge cost driver is administration. And we can reduce the administrative cost by making essentially all policies health savings kinds of a policy where there's no administrative cost for the first $8,000 of expenditure. A small doctor's practice may have 6 clerks sending in these insurance forms. The insurance company has to have another 6 clerks nitpicking those forms and sending them back. Probably 25% of healthcare costs are administrative costs. Why would we not want to increase that cost? There are a lot of ways to diminish that cost. We have fun doing that.
Let me say this: the healthcare bill is. I keep telling people, it is not a product; it is a project. There's still a lot of work to be done to perfect it. And it's a balancing thing. You know, when folks are talking about repealing it, they're talking about these court cases where two courts have ruled that it's unconstitutional to require, for example, that folk have health insurance, but a lot of people don't realize it. When you remove that piece of it, it has a detrimental effect on all the rest of it. For example, it affects things like getting rid of pre-existing conditions, things of that nature. So I think there's still a lot of work to be done. I think that the Congress hopefully will come together to try to address those issues. I'm hopeful that it will not, I hope the Congress will be able to resolve them. And I hope that we'll be able to do it in a fairly decent amount of time. But the fact is, ladies and gentlemen, that we got to keep one thing in mind, and I believe this very strongly. A sick society is not going to go very far. And when you've got 32 million plus people, more than that, many more than that, without health care, there's a major, major, major problem. And I've said it many times, I cannot imagine a person who has experienced cancer in their family or gone through cancer themselves not being sensitive to something like health care and trying to make sure that we address the problems of our nation. I've said it often, and I'll say it again, we're better than that.
Yeah, as a physician for 26 years, I've delivered it, and I'm really worried about the Independent Payment Board because it's the ultimate federal regulator. It's a group that is, they're not elected officials, they're one step removed from elected officials, and it takes a special act of Congress to overcome their adjudication. I will tell you, and the Congressman Cummings is right, I can't imagine what it would be to have cancer and be uninsured, but you know, just 2 months ago, a government regulator said Avastin, a very important drug for the treatment of breast cancer, just isn't going to be covered anymore. It's not indicated. Now, when the Independent Payment Board makes that decision, that's it. It takes an act of Congress to reverse it. And they'll make multiple decisions like that. And we've got to come to grips, and look, it's modeled after the same entity in Britain. We have to come to grips. If we want that kind of system, waiting lines, two levels of care, then let's as a country say, let's go for it. We're going to have a bare bones, restricted access, ration system, which is what the British system is. And then if you can afford insurance, you can have insurance on top of it. Or we're going to go toward what we've always had in America, which is a goal at least of a single high quality system. We just have to come to terms with what decision we're going to make.
Okay, thank you.